All right, we'll just wait a moment while we'll let people trickle in.
Okay.
And okay, can you see my screen?
Yes.
Yep. Okay, great. We'll all mute and just hand over to Liz. Thanks. Sorry, Liz, I was on the wrong screen then.
That's okay. Thanks, Katrina. Welcome everyone to supporting young people and their families through grief and suicide death. I'd like to begin by acknowledging the traditional owners and custodians of the lands and waterways from which we all are joining in from this evening. We recognise their diversity, resilience and ongoing place that Aboriginal and Torres Strait Islander people hold in our communities. We pay our respects to elders, both past and present, and commit to working together in the spirit of mutual understanding, respect and recognition. And I wish to extend our respect to any Aboriginal people connecting with us this evening. Hello everyone, my name is Elizabeth Barrett. I'm the Program Lead for Suicide Prevention at Westvic PHN, both in the Ballarat and Great South Coast region. I'd like to welcome you again to this webinar this evening. The majority of the webinar events, as some of you may know, are recorded and freely available on our PHN Learn YouTube channel. We have a practice communique that we send out to practices every 2 weeks, which contains valuable information, including items, both internal and external calendar events. I'm sure you'll find it very useful, and that can be subscribed to by our fortnightly newsletter, which is available on our website. Make note of the Westvic health pathways. I'm just wondering if you've got that up, Katrina, relating to this topic. And you'll find that this evening's webinar, like most of ours, are recorded, so you can access at any time should you want to revisit some of the learnings that you may encounter this evening. You will be muted, or put on mute, I should say, this evening to enhance the flow of the webinar. And if you do have any questions, please put them in the question box, and we'll have the panel answer those questions for you at the end, and they will be asked anonymously. The speakers for this evening are Christine Rawson from Support After Suicide, Hope Bereavement, Annie Norrish, Bereavement Counsellor, Hope Bereavement, Sue Eddy, Kids Grieve 2, and Catherine Dumaresq. I hope I've got that right, Catherine. Kids Grieve 2, Hope Bereavement. And also Christine, Kat and Sue will be joined by Headspace staff to help answer some of your questions. I would like to now hand over to Annie to take the lead into this evening's presentation. Over to you, Annie.
Thank you.
That's right, Sally. Perfect. We're on the first page.
Thanks, Sally. Just the next slide, if that's okay. So just the outline of our session tonight. We've sort of done introductions, so we won't go through ourselves again. We're going to be talking about support after suicide, how our organisation is set up to support people after suicide. And then Christine will be talking about loss and grief. And then we'll be talking about suicide itself and understanding suicide, and also suicide bereavement. And then the different needs of young people and parents, which Sue and Katrina will be talking about. So we'll get going. Thank you very much. So Support After Suicide is has been funded through the Department of Health, through the Victorian PHNs and the Freemasons and donations. It's a program of Hope Bereavement Care and Jesuit Social Services. So I actually work across those two services, and other people on the team work for Hope Bereavement. We're based in Geelong and also in Richmond in Melbourne, and counselling is available throughout all the suburbs in Melbourne as well. There's also been a recently newly established program in Sydney and Canberra, which is being set up at the moment. So we offer counselling to individuals, families and couples. It's free of charge and there is no limit on the number of sessions. We also run some support groups, an after suicide loss group, a men's program, a peer support coffee morning program, which is led by peer supporters. We have an early bereavement program, which is a 4-week intensive program, Kids Grieve 2, and also creative bereavement. Other activities that we do are information sessions like this for the community, secondary consultation, debriefing, education and training. We also have a Voices of Insight training program through Roses in the Ocean, which is a fantastic program for people with lived experience to sort of gain insight and confidence so that they might be able to speak about their experience either through the media or doing presentations and supporting us in our presentations. The Adventure Camp, which is run through Melbourne, but we participate in that as well. And we have a volunteer program as well across the organisation. So now I'd like to hand over to Christine. Thank you.
Good evening, everybody. Just in terms of taking care of yourself, there may be some topics and discussion this evening that may be a little bit triggering and unsettling. So please do just be mindful of that as we move through. Thank you, Sally. So I'm sure many of you appreciate that loss and grief is a huge topic and it's very complex, and this evening we have a very short amount of time to really cover an enormous area of work. So as I move through the loss and grief slides, I won't be talking through every slide or giving every detail about each slide. I will just cover the key points from each of the slides. This first slide that we have with Shoreline, I had a client that described her grief like she was standing with her back to the ocean. And there was this extraordinary sense of the unexpectedness of the waves when she wasn't aware when the waves were going to come. There was whether they were going to be small, whether they were going to be big, would she be able to withstand in the sand the waves that were lashing at her feet? And so we sort of, she gave her analogy that grief is very much like that, you know, like the ocean. It's unexpected, it's impermanent, unpredictable, and uncertain and changing all the time. The shoreline and the ocean is changing all the time with the tides and the streaming. And I just wanted to share that with you because that client perspective, with everything that I'll be discussing in this section, the loss and grief section, I wanted to just really emphasize the importance.
Sorry, Christine. I'm just going.
That really true listening and how much I learn and have learnt over the years. I've been a grief counsellor from our clients. An enormous. Thank you, Sally. Just waiting on the next slide.
Christine, we're just having a little bit of trouble with your connection there. Is everyone else having trouble?
Yeah.
Yes. Okay. So, Christine, I'm wondering, is there anyone that can take over from you for these slides, because you are cutting out quite a bit? So I'm happy, Sally,
I'm
for you to
dreadfully
make that
sorry.
call. That's okay. It was just over the last couple of minutes. Sally, would you like to make a call on that? Or do you want to push through?
Oh no, I think do you want to just quickly try again, Christine, and see if you're
Yes.
still glitching?
Can you hear me now? Is that okay?
Yeah.
It's just a connection issue.
Yeah.
Yeah. If it happens again, Annie, are you happy to take it on? Okay.
Okay, I'll continue, and just if you could just put your hand up if it's not coming across clearly. So this slide here, grief is our response to loss. It's complex. It throws us as this presentation is throwing us out a little bit with the glitching. It's the inevitable response to loss, and it affects every part of us, how we feel, what we think, how we behave, our relationships with others, and particularly our bodies, how we feel in our bodies, and also our sense of what's the world and our beliefs and what is life. Thank you. Is that sounding okay now? So our experiences of grief, I won't read through all of these, but I'm sure all of us in any experience of loss have experienced these feelings, some of, and others. And then the thoughts, some of the thoughts that we hear constantly from our clients, that sense of, I'll never get over this. My life has changed forever. I'm really scared of the future. Not being able to concentrate, just a complete inability to think clearly. And then our behaviours, how we are with our friends, how we are with our families, that loss of purposefulness, and then the change in how we integrate and relate to others changes. Lots of crying. And then the physical self. This is huge, where we feel so much of our grief in our bodies, and that impacts how we sleep. It impacts all of our sense of okayness in our bodies, lots of stomach pain. People describe a lot of headaches and chest pain and tightness in the stomach. And then there's also the spirituality and how we make sense of our world, questioning where we sit. I often speak with many women who have lost a partner, and so many of them talk about, who am I now without my partner? I was a package. He knew what I did, and I knew what he did, and now he is gone. I feel lost. I don't know who I am anymore. So trying to kind of find that person in them again. And then those extraordinary things that sometimes people get quite concerned about. You know, I'm dreaming all the time. I'm having these presents of my loved one appearing. Some of them can be very comforting. Some of them can be quite unsettling. Lots of those signs and symbols of seeing rainbows and birds landing on their window ledge. Lots of sounds and smells. People talk about, you know, when they're out and about, they smell something or see someone that reminds them of their loved one. So we're now going to move into just some of the different perspectives on grief that we consider in the space of loss and grief. Thank you, Sally. So the first one being anticipatory grief. The grief experienced before death by the dying person and those close to them. There's that anticipation, knowing that the person will die. i.e. the response to a terminal diagnosis or the impending loss. Palliative care, a form of readying oneself. And now just to talk a little bit more about Elizabeth Kubler-Ross, I will stumble over her name. Elizabeth was a Swiss-American psychiatrist, and she was the first significant person doing a body of work in near-death studies, and interviewed many dying patients in hospital. And she came up with the 5 stages of the receiving catastrophic news, but this then was interpreted as the 5 stages of grief after someone had died. Thank you, Sally. Just moving on to the next one. And what Elizabeth Kubler-Ross did was excellent work, but this was more about that before the person died and the stages of grief that were experienced in that anticipation of the death. So that then set up a bit of an expectation that grief was in sequential order. And we do know that that is not how grief unfolds. It's not sequential. So here we go, the stages of grief. Again, going to lots of those experiences that people have. It doesn't move from one side of the curve up to the other. What does actually happen is the following. It's all over the place. It's unpredictable. It isn't certainly not sequential. So disenfranchised grief. This is the grief that someone experiences when their loss is not recognised and fully acknowledged in society. And it's the relation, for instance, the relationship of someone not recognised in a same-sex relationship. The person's grieving is not recognised. The death is not recognised. So your grief is like your fingerprint, unique and personal to you. And we do, thank you, thank you. So the determinants of grief. So how someone grieves depends on how close they were to the person that's died. What was that attachment like? What are the circumstances around the death? Was it sudden? Was it unexpected? How traumatic was it? Was it cancer, suicide, murder, or a motor vehicle incident? And also, what other losses had the person had that you're supporting in the grief space? What other losses had they had that would really contribute to how their grieving goes and how it unfolds, and the impact of the loss that they actually are referred to us for? And the personal variables, the age of the person and their gender. Are they using alcohol and drugs? And then, of course, what is their culture? I've seen a couple of people lately where I've had to use the interpreting services, and that in itself has been really challenging, just to set that up, and then to really seek to understand the cultural differences of someone's loss and how they grieve. And we are seeing more and more of that now at Hope. And then, of course, the other concurrent stresses like financial, and what sometimes with when financial struggles are upon people, that can really add enormously to their grieving experience. Thank you, Sally. So what we know now, it used to be believed that grief was, it got smaller. It was all consuming at the beginning, and then it moves to being a lot smaller. And now what we do know is that grief in fact stays the same, and our life grows around it. And I'm constantly speaking with people who are saying that their grief is just the same. It might be the same 6 months on, a year on, and longer. And I explain that it's forever changing. It never stays the same, but the life will start to grow around it, and different things that come into their lives, whether it's new people or different experiences or finding a sense of purposefulness, will assist in that grief and the intensity of the grief. Thank you, Sally. So many years ago, grief was very much about, okay, the loss has happened, the funeral's happened, so let's sever the ties and just move on. Now, the more we actually we now encourage people to have that continuing bond with our loved ones. The death ends a life, but not a relationship. It's about what can we find to encourage our clients to continue that relationship and honour the person that's died. So all sorts of different, these are just some of the things that people use to continue that love link, that bond with the person that's died. Tattoos are, I'm not sure if they're not on that list, but tattoos are a big one. So the styles of grieving that we have, on the one side intuitive, and on the other side we have the instrumental, and it's a continuum. So it's neither always, someone doesn't grieve just on the intuitive or just on the instrumental. It can be blended between the two, and it varies on the circumstances and other factors, i.e. the relationship with the person who's died. So it isn't necessarily gender specific. It does say there that often but not always women on the intuitive, and then it says often but not always men on the instrumental side. So sometimes men can speak and be emotional and talkative, and women are the busy ones, but it can be difficult in relationships when their styles are different. When the thinkers are still grieving, even if they're not talking and crying. And then we have the dual process model, where we have, and the dual process model proposes that there's two processes at work. So on the left there, you can see we have loss orientation. And that's the real concentration of the loss, sorry, the concentration of the grief, the intrusion of the grief, trying to just constantly thinking about the deceased and life together as it had been, and focusing so much on the cause of how someone died. And there's the range of emotional reactions, from the pleasurable to the reminiscing and the painful longing and yearning. And then on the other side, we have the restoration oriented, where there's that trying to pay attention to the life changes, as I alluded to earlier, trying to get on with life and doing new things, or just trying to distract oneself from the grief by doing different tasks. And that sometimes there can be an avoidance. There can be, I can't face the loss, and so I'm just going to get on and with life and avoid going across there to dealing with the loss and grieving. But there is a real oscillation. So we move across to the loss orientate, and we move back to the restoration, hence the ziggy-zaggy line there. But that's necessary for the adjustment to the reality that someone's loved one has died. Thanks, Ali. And then there is the meaning reconstruction. So when we experience a loss, we also experience a loss of meaning, and that loss of purpose, that loss of an ability to feel any hope or any sense of the future and what the future is. Needing to make sense of what's just happened, particularly, and this will come out for in the next part of this presentation, in the more suicide bereavement specific slides. So making sense of the loss. And again, I mentioned about the identity, trying to rebuild a sense of self and our place in the world. Who are we now? And those relationships that change. I've had discussions with clients around the address book changes when there's been a significant loss, where there are some people who are in the address book and they remain in the address book because they are so supportive and they step up and help after the loss. And then some people in the address book drop off and you don't hear of them. And then there are new people that come into the address book. And I think that happens constantly with people who have experienced loss. And then and then there is complicated grief. Sorry, Sally, thank you. So complicated grief can be a traumatic bereavement, prolonged or delayed grief reactions, multiple losses, decreased support, previous history of mental illness, addictive behaviour, which affects, and the loss affects their day-to-day functioning, and professional help is indicated. Most grief is complex, but sometimes people can find it difficult to process and return to some normal functioning. It's also called prolonged grief disorder or complex grief reaction. And the diagnosis that is used in the DSM-5 that allows someone to get counselling support has continued, if it has continued for greater than 6 months, is when that diagnosis is given. We know that the usual grieving process takes longer than this, particularly when it's traumatic. That first year is a year of numbness and fear and firsts of so many things, and adjusting and coming out of that first year is huge. So one thing is certain, and that is the fact that grief never leaves us, however it changes and evolves. Your loss stays with you forever. It becomes a part of who you are. So the key thoughts from these slides: the different cultural patterns and different genders will influence grief. We don't get over profound grief, we get through it. We are changed. We've all probably heard the phrase that the new normal is different. Life will eventually have meaning again, but our loss will always be a part of us. Grief can be reawakened unexpectedly by anniversaries and special days. And often people talk about that it's the lead up and the anticipation of an anniversary or a birthday, which can be harder than the actual day itself, because they have sort of prepared themselves for it being a tough day. And a different public and private face. But we can learn to live with loss. Thank you. So I'll now hand over to Annie, and thank you for your patience at the beginning with glitching in the slides. Thank you, Annie.
Thanks, Christine. Okay, so I'm going to talk about understanding suicide. Thanks, Sally. Just want to start talking about some statistics. I can't say the word, sorry. As you know, we don't often have the updated statistics, although I will show you some that I have recently from the Coroner's Office. But these are the most recent sort of ones from the Australian Bureau of Statistics. And in 2019, there were 3,318 deaths registered as suicide in Australia, which means that there's over 8 a day, every day. 75% are men and 25% are women, and that's fairly consistent over the time that I've been doing this work. These figures in terms of the percentages don't really change. The highest proportion occurs amongst young and middle-aged people, as we know, and more than half occurred in 2019 between the ages of 30 and 59. Thanks, Sally. So suicide is the leading cause of death for all people between the ages of 15 and 44. And the most frequent method is hanging for both sexes, followed by drug overdose. And Aboriginal and Torres Strait Islander people are twice as likely to die by suicide, and people from the LGBTQI+ community are 2.5 times more likely to die from suicide. In 2019, there were 717 deaths in Victoria. 548 were men and 169 were women, and 472 lived in Melbourne and 245 lived in the rest of Victoria. So recently the coroner has actually put out some statistics, because there has been a lot of discussion about the impact of COVID and the lockdowns and the suicide rate increasing. And so the coroner has been putting out sort of fairly regular statistics. So in 2020, even though we haven't got the overall Australian statistics from the ABS, there were 713 suicides in Victoria. And as I said, there were 717 in 2019. So fairly much the same. So what the coroner has done is released some figures as of the year-to-date figures as of the 31st of May for each of those years. And as you can see, in 2019 there were 310, 2020 315, and this year up until May there was 276. So a lot of people are actually saying that the suicide rate has increased, and it doesn't make sense, because we're hearing a lot more about it at the moment. We're hearing a lot about mental health and people presenting to emergency departments. Services are busy, waiting lists are, are full. But what we sort of make of this is that, and this is sort of a bit of a phenomena that has occurred during the times of the wars, world wars, is that when there's greater social cohesion, the suicide rate actually doesn't go up. So I guess I just really wanted to emphasize that tonight, because we have a lot of people asking us about it. And at the moment, from our understanding, the suicide rate is the same. Thanks, Sally. I just did want to highlight, though, that year-to-date statistics for people under 18. In 2018, there were 7 deaths, and as you can see over time, that's increased. So last year there were 10, and unfortunately 6 of those were down in this area, Geelong region. And 2021, so far there's been 9 in Victoria. So I just wanted to highlight those stats before I start talking about suicide itself. Now, as Christine said, all bereavement is complex, and suicide bereavement is extremely complex. So we would say more so in many ways, and I'll just highlight some of those reasons. So there's a lot of factors that are involved when somebody does take their life, and it can be mental health, physical health, substance abuse, coping skills, a recent humiliation, impulsive behaviour, a relationship breakdown, financial problems, unemployment, etc. There's so many different things that come into play, but no factor should be taken in isolation. So we have this idea of this perfect storm, which Jack Jordan, who is a psychologist in the United States who writes a lot about suicide, and he says that sometimes it's a coming together of multiple factors in just the wrong way and at the wrong time. And it includes the person's biology, their thinking, their life circumstances, things that happened long ago, so early childhood experiences of trauma, as well as current stresses in their life, and everything just comes together in the wrong way, and that allows it to happen. So we often talk about this when we're working with people. We talk about the perfect storm, and people relate to this. There's a great deal of psychological pain in the world without suicide, but there is no suicide without a great deal of psychological pain. And that's a quote by Edward Schneidman, who also works a lot in this field. Thanks, Sally. So why is something that everyone asks. And what we would say is that he or she probably wasn't choosing death as much as choosing to end their unbearable pain, psychological pain. And the trigger is not always the cause. Often people will talk about the fact that something has happened and that's been the reason for the suicide. But again, we would say that there are multiple factors and a lot of things are happening at the same time and a significant stress. And there may be some things that have looked like that's been the trigger, but it's not necessarily the underlying cause. There's a fellow in the States called Thomas Joyner who lost his father to suicide when he was about 18, and he spent many years researching suicide. And the things that he's actually found, and he talks about these 3 different areas. And the first one is that people feel a disconnection from others, a sense of isolation. And often that's about their sense of not belonging or relationships that have broken up and ruptured, and feeling isolated and separate. And certainly at the moment, there's a lot of people feeling that way. Thanks, Sally. Sometimes you hear people say that they feel like they're a burden to others. And we all need to feel like we have, you know, that we're productive and effective. And people say things like, you know, they'll be better off without me. My death will be worth more than my life. And the other thing that needs to be able to happen, you know, we have a natural instinct for self-preservation. And so people have to have the ability to enact the lethal self-injury. So some, you know, fearlessness around that. You often find that there's a history of risk-taking, high risk-taking behaviours or attempts in people that have died from suicide. Sometimes there's an underlying mental health issue or depression, but not with everybody. And we would say that perhaps 85–90% of people, there can be other reasons, but certainly it can be a major factor in, you know, people feeling that they're not belonging, and often that they're not really letting people know how they're feeling, and they're deceiving their friends. And sometimes people have no idea, and that's why it can be a very sudden thing when somebody takes their life, because they're not always talking about it and telling people how they're feeling. So just to talk a bit about suicide bereavement, Carla Fine is a person who wrote a very good book based on her experience, and she says that the death of a significant other by suicide is a stressor of unparalleled magnitude in most people's lives, and even the most psychologically mature individual may encounter difficulty in responding to it. And I would agree with that, having done this work for nearly 10 years. I think that it's probably the most difficult experience that anyone can go through. So when we talk about suicide bereavement, we're talking about grief and loss. And as Christine said, there's a potential for complicated grief. All grief is complicated, but when it's sudden and traumatic, then it's going to be much more complicated, particularly when there's that element of trauma with the potential for PTSD. And as we know, sometimes people find their loved one or witness a suicide, and there's that added sort of component of trauma that's involved in that. The other factor with suicide is that it's deliberate, it's intentional, it's self-inflicted. The person has actually done that to themselves. And so sometimes people who have lost someone to suicide also experience the risk of suicide themselves. The suicide bereavement can be stigmatising. People often feel a sense of guilt or shame and feel isolated from others because people don't talk about it because of the stigma. Some of the feelings that people are left with, like Christine was showing before, that sense of shame, the shock, the crisis of values, anger, their sense of identity. Who are they now without that person in their lives? Blaming themselves. Blame's a huge factor in people who are suicide bereaved. They blame themselves, sometimes they blame others. And that sense of guilt is something that they have to work through ongoingly. So some of the questions that they might be asking are, why did they do it? why didn't I prevent it, and how could they do this to me? So people believe that they, you know, should have seen it coming and should have been able to do something about it. And we do talk about suicide being preventable. We would say that suicide bereavement is different to other deaths, as I said before, that a sudden and violent death, be it a murder or a car accident, is incredibly traumatic. All deaths are traumatic, but the research shows, and Jack Jordan has shown this, is that suicide death is probably the most traumatic, in that the length of shock and the degree to which people experience that shock and numbness, as Christine was talking about, goes on a lot longer. You know, it lasts much longer than 6 months. Often we say to people around that 5 or 6 month period is the time when you'll often start to be feeling it even more, and you're going through those first experiences, you know, their first birthday, the first Mother's Day, Father's Day, whatever, first anniversary, and the reality starts to get greater over time. But that first few years is often very difficult compared to other bereavements. So just a little bit about trauma. You know, we know that the word trauma means a wound, and it's an event that pierces the mind and fractures everyday meanings. And there are different kinds of trauma. Sometimes it's direct and it's something that someone experiences, or sometimes it's informational or imaginal. And some people, even though they may not have found their loved one, would be imagining how they died and what they went through when they died. And traumatic stress can cause, post-traumatic stress can cause intrusion and re-experiencing flashbacks. People often want to avoid where the person has died or the situation, you know, the place where they died. And we see people all the time who are hypervigilant and have that sort of the physiological responses that Christine was talking about, those physical responses to the trauma. So this is a really good learning cartoon that just sort of, I guess, you know, is a portrayal of what really how it is for people, that the way life is supposed to be, you know, it's very, very different. It's quite fractured and jumbled. Sometimes we talk about it being like an existential shattering, and that your life just gets torn into thousands of tiny shreds. And how does it affect someone's identity and their sense of self? Some people experience the suicide reflecting on them. And what does it say about me as a person? You know, if this person has taken their life, did they still love me? So it can undermine your sense of self, and often leads to people feeling, you know, not good about themselves and questioning their self-worth and identity, and feeling abandoned, and really undermines the quality of the relationship that they have with that person. There's a search for an explanation, wanting to understand why. And this process involves feelings and thoughts of guilt, as I said before, and blame and regret. And it's a long-term process. And what we often say to people is that the goal really is to develop a complex and realistic and compassionate narrative about what really happened. It's like you're putting together all these different pieces, and jigsaw sounds very simplistic, but trying to put things together to understand it. And yet a lot of people have said to me that they never really get to a point where they truly understand what happened and why. Some people talk about the dead ends, the guilt dead ends, and that the fact that they ruminate and just go endlessly over things, and the things that they did say or the things that they didn't say, should have done or could have done, and eventually realise that they didn't die because of something that they did or didn't do. Thanks, Sally. So we talk about guilt in the fair trial. We have a lovely handout that Jack Jordan talks about the fact that in hindsight, people often develop a sort of fixed perception of their failure to have done something, to have recognised the warning signs, to intervene and stop it, and they overestimate the power and influence on the events leading up to the suicide, and they underestimate or don't know all the factors that contributed to the death. So often there's this sense of what we don't know that we don't know. Next, Sally. People really experience a sense of acute failure. It's an acute sense of failure, sorry. and they often think about how others will see them, and this has a ripple effect across their areas of life, but also, as we know, across the whole community as well. And this impacts on people's social network and family relationships. Often, I guess with this work, I'm surprised at how many families actually do experience conflict with one another and withdraw, and it can result in estrangement, unfortunately, because of the blaming and that sense of wanting to, to find answers and blaming themselves as well and withdrawing from each other. There's often dilemmas about what to say to other people. How do you explain this? What do you say at the funeral? And there's a lot of stress involved with the involvement of police in the coronial process that is different to other kinds of deaths as well. This is just a quote from someone who said that they felt like that they had the word suicide widow tattooed on their forehead, and people often talk about the fact that they feel like they're exposed, that people are looking at them and talking about them, and to the point where people have often felt that or talked about the fact that they're walking down the street and somebody will walk on the opposite side of the street and just ignore them and not talk to them. So it can leave somebody feeling, blamed and isolated. So the literature actually says that being bereaved by suicide elevates the risk of suicide for those left behind, and that's why our service exists, really, because in terms of it being part of a post-vention response, we do see people who are often elevated in terms of their risk and can be suicidal. Sometimes they're identifying with the deceased and they want to be with them, or they feel that because of the blame that they need to punish themselves. And sometimes it feels like it can be a family curse. Who's going to be next? I might be the next. And sometimes it's an interaction of all of these. So it's really important that we have a risk assessment as part of our work when we're working with people bereaved by suicide. And this is just an example of what somebody was saying about the fact that somebody was fighting their own battle, and it may be that somebody's never experienced those feelings, but the stress and the trauma of what they are experiencing does end up, with them feeling suicidal themselves. People often say things to us that, that they want to die, but sometimes when you explore that with people, it's more that they are missing their loved one so much and they want to be with that person. So, but it's good to have those conversations with people and make sure that you are assessing them, for that risk of suicide. As I said, the impact of suicide can be likened, to a stone that's thrown into a lake and has this enormous ripple effect. And the thing that we've experienced in this area in Geelong is that ripple effect throughout the whole community, particularly last year and also this year. So it's important to provide support. Grief is a lonely experience, but we walk alongside people during their journey. Thanks, Sally. And what we feel is that the bereaved person needs to feel listened to, heard and understood, and we provide non-judgmental support to tell their story, to have a safe environment that's supportive, express their grief, have no time limits. Unfortunately, we can provide that, and also connect with others who've had a similar lived experience. And these are just some of the goals. Jack Jordan, again, who I've talked about before, just talks about some of the things in terms of suicide bereavement work and containing the trauma, helping people to manage the pain and distress of the grief, of finding ways of managing and comforting themselves, creation of the good enough story, which is what I mentioned before, repairing connections with their loved one, if the relationship has ended in a very sort of distressing way before that person died, in conflict, and remembering the deceased with a more positive context of their story. Thanks, Sally. So I just want to finish on just talking very quickly about speaking safely about suicide. It's really just to highlight the fact that we don't use terms like successful suicide, unsuccessful suicide, or completing suicide. what we do say is that somebody took their own life, or they ended their own life, or they died by suicide. Also, we avoid phrases like committing suicide, the word committing suicide, because it implies a crime or a sin. So again, it's somebody died by suicide or took their own life. And just trying to avoid things like sensationalizing suicide, simplifying it, again, saying that one event caused that suicide. There's a lot of talk about COVID and, you know, the impact of COVID and how that might be, you know, affecting some of the young people. And at the moment, that's something that's being investigated by the coroner as, you know, the impact of COVID, but not necessarily the cause of, you know, young people who've taken their lives. And again, judgment or criticism of the person who's died, and trying not to talk too much about location and method and excessive or graphic details. Thanks, Sally. Okay, now I'm going to hand over to Sue, who's going to talk about young people and families. Thank you.
Thank you, Annie. So you can hear me okay? Great. So the impact of suicide on a family. It doesn't get much tougher than that, really, as a topic, does it? So it's really difficult to discuss this without being able to see who's listening and who's in the audience. And I find that strangely very strange. We talk about the ripple effect of suicide on communities and on families, and the ripple effect of all of you being health professionals have probably felt that in various ways. So just wanting to really acknowledge that this, as Christine mentioned, this may be triggering all sorts of things, and we wouldn't be in this profession if we didn't care. So being aware of that. Because when we're looking at impact of suicide on families, it's hard to imagine anything more tragic. We had that analogy from Christine about the shoreline. And when you think of the shoreline analogy for a person standing with their back to the ocean, then you picture that as a family standing with their back to the ocean, all sort of with separate waves and separate tsunamis and separate rips and separate currents. It becomes really complicated. Our work at Hope, we have the opportunity of being able to wrap around a family. And we've got professionals here from each different background and field. And together, we like to feel that we're kind of weaving a bit of a hammock around families so we can support each other in that work and support the family. Also supporting the community and being able to link in with other services. So none of us are doing this alone, because it's incredibly challenging, incredibly complex work. And we all feel really, really honoured to be able to do it. So as we looked at the impact of suicide on individuals is complex. On families, it can weave through the whole fabric and tear it apart of a family. And for those of you that have been in that post-vention space, when you walk into that shocked silence in the aftermath of a suicide, whether in a school community, sporting community, a friendship network, or a family, it's that shocked silence that always gets me. So the sense of identity as a family can be absolutely blown apart. The communication, how are we going to even speak about this? How do we speak about the person? And there'll be as many different ways of doing that as there are different family systems and structures. There might be wanting to protect each other. We don't want to bring it up. It becomes like an elephant in the room that no one can actually talk about. And of course, the acknowledgement of the different grieving styles and different timeframes. Everybody be grieving differently. There's no one way of doing it. And when that clashes, it can be like that crazy ocean that is just so powerful. The impact of secrecy, and when I studied family therapy, we looked at the way secrets can actually separate families. family members, who knows what and who owns the secret. When some people have information and others don't, it can be very divisive in a really subtle way. So it's really hard to know how much to tell, how much to share. That can be really difficult to navigate for families. And of course, there's conflict. When we're under that much stress and we're triggered, we blame either ourselves or others. And who better to blame than people in the family system? It can really create some incredible disharmony and things that often go unresolved. So the anger can be turned inwardly, or we can blame and project onto others. Thank you, Sally. So again, impact of suicide on a family can look as different in every family that we deal with. The anxiety and the worrying about other family members. Parents can become helicopter parents, and you can understand that, wanting to be incredibly vigilant and everybody and checking on how everybody else is doing. Likewise, a parent or any number of people in the family can become quite detached and unavailable to others. And that can change within a day, an hour, a minute, in fact, between being over-involved and over-concerned and quite paranoid to actually quite disconnected. So, you know, that has to be taken into account. There can be so many changes in the family dynamics and structure, depending on the structure that was there before. We talk about in family therapy about perturbing a system. It can really throw up all the pre-existing patterns. And as if we've listed here, depending on, you know, a child might become an only child. They might become the oldest child or the youngest child suddenly. There's all sorts of developmental stages in a family, particularly when somebody reaches the age of a sibling who's died. And of course, it differs very much according to whether there's a one-parent family. We talk about the blame and anger tendency, and in separated families, of course, if there's a wedge, it soon becomes a chasm often. So when everybody's grieving, often there's that syndrome where who's holding this family, and either everybody can be trying to hold it or everyone steps back, and it's a real dance. So roles can change, and we talk in family therapy also about people developing a role within a family, and we're all like an actors on a stage, and we can get pretty typecast in our role within a family. We can be the funny one, the academic one, the good one, the bad one, the rebel. And often when there's a hole left in a family, other children can step into that role, and it can be really uncomfortable as we're adjusting to new roles. Children can also step up and be parentified. And of course, these roles can shift and change and challenge. There's a whole lot of other stressors often happening, coexisting in a family, lots of financial problems. Often people can't work as they were. There can be all sorts of disruptions in housing. Thank you, Sally. So the family, as I described, the family need often this wraparound system. It's really hard to determine what people need when, and often the families don't even know. So it's being available and being there to help and assist in whatever the family needs. And of course, different members of family will need different things at different times. So as I described, we sort of try to provide this sort of hammock structure. And it's a little like trying to befriend a shy pigeon. We're not throwing things at families saying, here you go, you need this, you need that, let's try this. We're just sort of putting the seed there and saying, this is who we are, this is where we are. And being able to provide that flexible model for families to dip in and out of has been the most important part of Hope's journey. The family itself need increased communication and closeness. What we often do in times of trauma and stress, we either have a habit of leaning in or leaning out. And that can be really challenging to help people lean in to one another. communication and things. It's so challenging to communicate clearly when everybody is under stress. Drawing together and supporting each other when everyone is in so much pain. And also being aware of the needs of others can be so difficult when we're just surviving ourselves and just keeping our nose above the waterline, to try and actually be aware of what others in the family need. And that's why it's helpful to be able to call in teams of people. I liken family trauma, and of course it doesn't get much more traumatic, but it becomes a bit like a war zone in a family where people are sort of, it's difficult for people to be on the same team. What I like to think of it is more like a tennis match, if you like, where we want the family to all be on the one side and the grief and the bereavement and the trauma on the other. So it's helping people unite together against the trauma and the challenges, rather than becoming against one another, which is often what happens. Thank you, Sal. So just like we said that the needs can be so complex and we need to be so adaptable, and certainly being aware of what parents might need in a grief or bereavement, what the young people might need, and what the family needs collectively. So we're just going to talk particularly about the young person right now. And just factors that affect a young person's grief experience. So this is just expanding it a little bit, not necessarily bereavement within a family, although it could be that, but this could be young people's grief experience when they've lost a friend at school, lost somebody else in the family. So the factors that affect young people's grief experience is the age and their understanding of death. Annie was talking about meaning making. And for young people, it's really important to sort of step into their world and help them navigate their understanding of the death. Have I caused it in some way? And is there something I could have done differently? And that's so common for young people. Their home and family circumstances, just so important as to whether it's a positive experience or whether it's challenging. The strength of the family ties, who a young person can actually go to and talk to. Emotional and financial stability. Of course, young people aren't renowned to be the most emotionally stable. There's so many other factors going on for them. So it's going to, if things were unstable before, it's going to really make that more so. We have to be careful, though, of the young people who are supposedly coping very, very well. And there's a lot of things in the literature. The people that are coping very, very well are often the people who are really shut down and avoidant, and long-term don't do so well. So the idea that emotional instability is actually the perfect response in a lot of cases. And they're often the young people that get sent to lots of services because they're unstable. So I just want to highlight the fact that beware of the young person that seems incredibly stable, because often there's this disconnect and this shutdown and a lack of connection to emotions. Support of relatives, and it is the time to bring in the team, but bring in the helpful members of the team. So being able to link in with the relatives that are supportive and not so much with the ones that aren't able to provide positive support. Of course, we've got the previous losses, and there's this cumulative effect, particularly for young people. If they haven't been able to process previous losses, they haven't been able to make any sense of previous things, it might be the straw. And even this might go as far as pet loss. It might be the straw that tips them into grieving the loss of all of the people that they've lost before them. Individual personality, and we know there's certain personality factors and traits that actually ensure people are going to be a little more able to develop resilience towards grief and loss. And there's certainly personality variables that make us more vulnerable. Spiritual upbringing is important to consider. And just like Christine was talking about the cultural dimensions of grief, there's also spiritual aspects. I know going to a young person's funeral, a few years ago, and there was this lovely spiritual connection about this young person had gone to a really great place, and it actually wasn't as traumatic as for people that have very different spiritual upbringings, particularly around suicide. We have to take into account what those spiritual meanings might mean of the loss. Giving people experience and permission to grieve, and being able to provide the space to normalise the responses, so important. Having adult role models. When I run the Assist and the Safe Talk workshops around suicide post-vention, there's some beautiful video clips about adult role models being able to actually just model appropriate grief, allowing the emotions to flow through us and not disconnecting, not shutting away from them, but just allowing creative expressions of grief is the most important thing we can do, whether it's as health professionals or parents, is being able to model good grief, whatever that looks like, authentic grief and authentic connection. Thank you, Sally. So adolescence being a normal time of transition, rapid change and growth. And of course, this can set us back for young people developmentally. They can revert to previous developmental stages, or of course, they can become more parentified and develop strategies around racing through adolescence. They might be confused and overwhelmed by the intensity. Having very strong bonds with friends. It can worry families often when young people want to get out of the house and just connect with friends and not so much connect with family. But of course, that's what they often do, especially after death of a friend. That's who they crave to connect with and be around. So often adolescents grieve very differently to adults. They move in and out of their strong emotions. And rather than expressing their feelings, you'll often see what they're feeling through their behaviours and actions. So being able to help create some safe places where they can express those behavioural reactions to what's happened. I'm conscious of the time, 7:37. I'm wondering whether we move through this bit, Sally, and go on to the where to for help, because I just wanted to mention
You can finish it off. Keep going.
Okay, cool. So adolescence, there's this internal dilemma, ambivalence around adolescence. While they don't want to be different, they want to be similar to their peers and friends, but they also don't want to be known as that child who's lost someone in the family. So it can be really triggering for them to feel like they're carrying the shame and the stigma, and they don't want to be different to their friends. They can feel fearful or angry, and often, they cover up vulnerability, like we all can, with anger. And often we'll see the anger and the irritability, and it's very difficult to respond to the vulnerability that's often happening underneath, not reacting to the behaviours and anger, the emotion, getting under that and getting to the vulnerability. We'll often see a sign that they're withdrawing and dropping out of activities, which, can be very, very difficult, very challenging to know what to do when that's happening. And they may be unwilling to seek support from parents as they strive to be independent. And that's where it becomes very important to find, well, where else can we send young people if they're not able to talk to parents? Impatience and irritability, as I said before, it might be a sign of their vulnerability. Difficult to concentrate, and particularly if we're talking about a traumatic bereavement, it can mimic PTSD, where a lot of the frontal lobe can be offline, really difficult to concentrate, can be difficult to set goals, problem solving, social perception goes out the window, and it's very difficult to hold young people in that. Just giving them space and time. They can act with bravado as if they're not affected. And they can also be very sensitive and protective of people around them. Thanks, Sally. They can feel alienated, and we know this about loss, bereavement, trauma can actually make us feel really separated, can separate ourselves from our own emotions and also separate us from others. So it can be a very lonely, very isolating experience. They can take on roles of more responsibility and looking after others, which can actually be a distraction from their own pain. It can be likely they will experience a roller coaster of emotions with unexpected changes in mood and act out this through risk-taking behaviour. The guilt around others' death can be incredible. And also they can feel guilty about wanting to feel normal again. I've experienced this lots of times where young people actually, once they start feeling a bit more joy in their life, they can feel really quite guilty about that because the person who's deceased doesn't get the opportunity to feel that joy. So I just wanted to mention about young people, what they need here. They need to know the truth. They need to be heard and listened to and acknowledged of their feelings. They need reassurance that they're safe and cared for. They need honest and open communication. And sometimes they either need less responsibilities and to have some time to heal, or perhaps they need some increased structure and routine just to help them get back. Also fun activities, distraction. We talk at Hope about trying to find some creative ways of helping young people grieve, and encouragement in the expression of grief. So before we move on to the next slide, Sal, I just wanted to talk a little bit about, Annie mentioned about the risk factors of thoughts of suicide in young people that are bereaved. And, you know, we talk about these copycat suicides in the community. Now, it is a really common thing for somebody who's really hurting with the pain of the suicide of somebody to actually consider that an option themselves to end the pain. So in the Safe Talk workshops, we run half-day Safe Talk workshops, and safe meaning suicide suicide awareness for everybody. And the idea that suicide prevention is everybody's business in a community. And we need to all be aware of what to know, what to look out for, and how to ask people, particularly young people, about suicide. So that we go through in lots of workshops about the barriers to suicide, to asking about suicide. And one of the biggest barriers is just not knowing how, not knowing when and not knowing how. So we encourage people to get confident to ask the question. And a really simple model we can keep in the back of our minds when we're asking young people about suicide is just feeding to them what we've noticed. We've noticed you haven't been attending school. We've noticed you're quite withdrawn and you're not going to football training. We know that a lot of people that do those things are thinking about suicide. Are you thinking about suicide? So what we're doing is really just feeding back to them what we've noticed and asking the question. Now, people are often reluctant to ask the question because there's this myth that if I ask the question, it might plant that seed in that young person's mind, but the evidence shows it doesn't. None of us are strong enough to really be able to plant ideas in people's minds and have them follow it through. So it is just so important because that gives the young person, if they're not having thoughts of suicide, that's fabulous. But if they are, it gives them the idea that you're a safe person that can actually ask that question. Now, there's a lot of barriers. People might not want to ask that question because then what do you do if they say yes? And that will depend on time, circumstances, where you are. But it alerts you to the fact that they are, and this young person needs help. And we're going to move on now with where to for help. So in the Assist 2-day workshops, even after a day and a half of talking about the importance of asking the question directly, when we get into the role play section, people and often even health professionals are reluctant to actually ask those questions. So asking clearly and directly, not are you thinking of doing anything silly? Are you thinking of doing anything you'll regret? You're not doing anything, you know, those sorts of roundabout foggy questions don't cut it. It's directly, are you thinking about suicide or are you thinking about ending your life? If so, I'm a safe person you can talk to about that. and we can get you some help.
So I'm just going to add there as well that I know talking to some young people around after there's been a number of suicide deaths, and when people ask them about are they thinking about suicide, they say, of course, who isn't thinking about suicide at the moment? That's all we talk about it. So that's when you just need to kind of ask that follow-up question about, are they thinking about, wanting to die? And the other thing that young people have told us as well is that they feel like they're being risk assessed all the time and nobody's talking about their friend that died. And one young person said, I feel like I'm a bomb and everybody's too scared to do anything in case I explode. And nobody wants to talk about the death because they think I'll be upset. And I know that you guys have talked about this a lot, about the concept of talking about someone that's died making you upset. They know that they're dead, they are upset. You're just maybe raising it might make them cry, which might make you feel uncomfortable, but the person is already upset. So just some things that young people have said.
Yeah, really good point. That's right, tiptoeing around it. And as we said before, we'll be the best models as adults for young people, and allowing those emotions to come out. It is sad, it's devastating. And if we can't demonstrate and model healthy responses to that, then what does it tell our young people? That we have to tiptoe around and we can't express those emotions. So, yeah, good point, Sally. So parents need to be aware of their own grief and what they're modelling. As Sal said, it is distressing, and let's model to parents that it's okay to be distressed. Protecting children and providing support, and they need to know where to go to get good sound advice and support. Knowing children are safe, I mean, that's a tough one. Parents need to be in control, and that's tough too. To actually allow parents to feel in control, that's going to be very difficult. But of course, if they feel like they've got some support around them and they know where to go for help, that will help settle the young people. To be able to talk to young people and being able to get support for themselves from family and friends. Empowering parents is just so important. I mean, I was doing a suicide intervention for a young person the other day, and she didn't need her mum to know all the details. She just needed her mum to know if she comes into the bed at 3 o'clock in the morning, she just wants to lay beside her and hold her hand. And empowering the mum, oh, is that all I have to do? What a good thing. I just need to know what I need to do and what would be helpful at a time like this. So empowering parents to be able to do what would be helpful at the time. Letting them know they're available and can talk to them. So, yeah, being able to empower the parents to be available. So in that, we're going to pass over now to Kat.
So sorry that we've gone a little bit over time. Kat's just got another couple of minutes to go through some of her stuff, and then we'll leave some room for questions. So don't rush, Kat, but yeah.
Pardon me, I'm just going to speak a little bit about our Kids Grieve 2 program. It's a new leg of hope that started due to funding we received from the Costa Foundation. And it's a service for bereaved children and young people and those in the community who care for them. So in the service, we provide individual, family and peer group support and counselling. We can provide information and education for young people, for the families and those that support them, such as schools and community service providers. We're developing a resource library that's going to be hopefully at the Geelong Library so that everyone can access it. We give the young people opportunities to meet other bereaved young people and children so that they don't feel like they're the only person that this has happened to. It can normalise, I hate that word, but it can make them feel a little bit more like they're connected to people who've had similar experiences. We're planning to run child and youth bereavement sessions, both formal, so the more closed educational groups, and informal, so peer supports that are more longer running and just informal ways they can connect with each other. These school holidays, we're having a memory morning for children who are bereaved in all sorts of ways, not just suicide. And we also can provide secondary consultation and support or education for professionals. And I would encourage you, if you've got an existing relationship with a young person and you're just a little bit unsure as to how to support them, to contact our team for some support for yourselves. Don't underestimate the relationship and the importance of that relationship that you have with the bereaved person. But if you feel that you can't do that, then feel free to refer to us. I've just written, existing therapeutic relationships are very important. There's a thought that therapy is as much about how we do as what we do. So just keep that in mind. Next month, we're starting a co-location alliance with Headspace Geelong, which is quite exciting. It's 1 day a week, so young people are able to access hope services in a place that's potentially more comfortable for them or more accessible for them. And that we try really hard to provide access as flexibly as we can through all of our service, so that we can have as much access for people as possible. Yeah, and I think that's me. Was I saying more than that?
I think we'll just go on to questions, do you think now, Sally? Because unless you want to run through those resources, but people can see them in the handouts. But just to know that maybe go to the next one too. There's that one, information and support for parents. And we have a supporting young people after a suicide death resource, which if people want that, it can be emailed to them. You can't really see it in detail here, but there's a lot of information there. It's a digital tool, isn't it? With lots of links to different resources.
So it's sort of like a bit of a guide for professionals to find resources without having to necessarily come to our specific service. So there's a lot of stuff. If you type suicide into the your search engine, you can get to some very, very odd places. So this is sort of a group effort with Standby and Jesuits and Hope together to try to get to the right places for professionals to find service support.
Sally, it's Katrina here. Just wondering if you can see the questions now in the question box. Otherwise, I can ask them.
But I can't see any questions.
Oh, that's okay. I'll ask them. We have gone over time. I'm just really conscious that people are wanting to get back to their families. So we might just do a really quick rapid fire question at the end. So I've just, I'll ask this of the panelists who were speaking when the question popped up. So Annie, are there any stats on attempted suicide?
There are stats. They're not stats that I have at the moment, unfortunately, but I think through the ABS, Australian Bureau of Statistics, they certainly have those statistics.
Okay. If you'd like to send me something to include in the post-session email, we can do that for you. The second question is also to you, Annie. Does the risk that you were speaking about, risk-taking, equate to impulsiveness?
Sorry, I'm not sure what that was related to.
It's hard to think back to a presentation.
Yeah, talking about impulsivity.
Yes. So does that risk-taking equate to impulsiveness?
Well, I think they can be two different things, but certainly people can, have risk-taking behaviours. But certainly when it comes to, particularly with young people, there's a lot of talk about the fact that there can be, an element of impulsivity. Does somebody else want to add to that? Sally, do you want to say anything to that?
Yeah, I think the question was around when you were talking about some of the risks for what the things that you need to do when you are thinking about dying by suicide and having that sense of being able to kind of override our natural thing about stopping ourselves. I mean, I think that anyone that works with young people understand that they can be really impulsive, or it can seem impulsive to adults because time moves really differently with young people than it does to adults. So I think that young people are at risk because they're impulsive, because if they're risk-taking behaviour, but also in Geelong because they've had exposure to multiple friends or acquaintances die by suicide.
Thanks, Sally. The next question is to Sue. How do rural locations access your services, Sue?
What a great question. Rural locations accessing our service. We, especially with COVID now, we can do all sorts of things. We can do Zoom calls or face-to-face, telephone. We're out and about on the road, so depending on how rural we're talking, there's flexibility, especially with the Kids Grieve 2 program. Kat and I can see people in all sorts of locations out and about. So depending on how rural you're talking.
So JSS cover the state, they're a statewide service, so the support after suicide. So if you direct your referrals to either Hope or to JSS, at the moment we cover Geelong, Golden Plains, Surf Coast, and Queenscliff. We do some work with people that come to us from Colac, but while we're Zooming, we can do more work. And so I assume that there's people from kind of the Ballarat region that are at the session that might be interested. And I think that there's some support services up in Ballarat, and you probably should contact JSS or just give us a ring and have a talk to them, because while we're Zooming, we can probably do some stuff, but we will do it in conjunction with Jesuit, with the Support After Suicide Australia.
And Sally, the person that asked that question has just added into that Q&A that the teenagers aren't loving the telehealth in their region, so that's probably good to note as well. So next question, is there family counselling support available for families who have been impacted by suicide without a cost in Geelong?
Yes, that's what Hope does.
Yeah,
okay.
No cost. Yeah.
Great. Next one is also for you, Sue. Any tips on supporting young people being told to suicide at school, in person or on social media, aside from ignore it or block them?
Oh, find new friends. So this is with friends saying to people about that. Is that in the chat?
There isn't any more information about that, but it just says people at school, they're hearing this. So at school, in person or on social media.
Oh, it's such a problem. So building resilience to that sort of thing, and seeking out advice from places like Headspace to be able to build resilience to those sorts of messages.
And if schools know about it or families know about it, that's where we need more than one person in a room to have a conversation about what we can do in terms of some global kind of conversations with groups of young people about the effects of those sorts of behaviours. But, you know, this is it is a big problem, but it's always been a big problem, but now it can happen at 12 a.m. So, you know, young parents should feel empowered to turn off social media at 12 a.m. I don't know, it's really hard, but yeah, so I don't know. I don't think any one of us has an answer, but we need to talk to young people about what they think would help, about how they're making sense of that and what that language means to them, because it can be really different for different people. So what I would say is talk to your young person about it, like really try not to be too outraged by the behaviour, but have conversations with the young person that is doing it or the young people that are having it. It's all about communicating with them and finding out what they think will work, because our kids are really smart if we tap into them.
So just a couple of comments that have come through from the person that put this down, and then we will need to wrap up, saying that schools aren't taking it seriously or shake the blame, and that taking social media away can increase the anxiety around being isolated as well.
So I'm not saying take it away, I'm just saying that you can limit when it happens, you can have some control over when it happens, and schools are doing that all the time. I'm really disappointed if schools aren't taking it seriously, and I would suggest that you contact, I mean, we've been in, you know, unfortunately a lot of meetings with the education department, the Catholic education department and the independent schools, and certainly everyone that's attending for now are taking it incredibly serious, and so are all the teachers and people in the room at the time. And perhaps it's about going to those people and saying that, you know, this is nothing to muck around with. I mean, we know that these things can be a part of the perfect storm that Annie's talking about, and we don't want to add any triggers for young people. So I would be having those conversations and raising it with those school communities, because, you know, we know what can cause more problems. We can't fix everything, but we know what's going to add to it, and that would be it.
Okay, I think Liz is going to jump in now and finish off the evening.
Wrap up. Thank you. And on behalf of the participants this evening, I'd like to thank the presenters for a really informative session from the panel. Thank you very much for making yourselves available on such short notice and sharing some valuable information. Thank you again to all the participants as well for coming along. And just a quick reminder to complete the post-webinar survey.